Dairy and sugar are probably the two biggest foods that have been shown to contribute to acne flares, and skim milk rather than whole milk. And that's more because of the sugar content in the skim milk.
Hey guys, welcome to this week of Waste Away. And today's guest is Dr. Keira Barr, and she's a dermatologist at the Resilient Health Institute in Washington. And she helps people who struggle to be comfortable in their skin. And she is going to tell us a little bit about her own health journey and tell you all about acne, your skin, and how you can feel more comfortable and confident. So welcome, Dr. Keira.
Thank you. Thank you for having me.
So tell us a little bit about your skin looks amazing. So did you ever personally have any issues with acne?
Just the occasional zit that was always at the most inopportune time, but I was fortunate that I didn't deal with significant acne, but I had other skin issues that caused some challenges for me, for sure.
What was the other skin issues that you had?
So I was born with two birthmarks, one on each side of my face. And as a kid, I was bullied for their appearance. And for me, I learned quickly that if I got tan, which I was never meant to tan, even though I have dark hair, my dad's a redhead, so I burned. But I tried to mask them. And as a dermatologist, I learned how dangerous that actually was. And in fact, had to diagnose myself with melanoma. So not acne, but something a lot more life-threatening.
Gotcha. We've been getting a lot of questions on acne and cystic acne lately. So can you talk a little bit about what are the best and worst foods for acne, and how does the food you eat directly affect your acne levels, and how your gut health directly affects it?
Great questions, great questions. And so my answer is going to be, it depends. So there's a lot of information out there, kind of broad sweeping generalities that may apply in terms of inflammatory or non-inflammatory food. But I think in this day and age where there's so much information readily available, and being very dogmatic about things can add a lot of stress and overwhelm to people, as they're already feeling stressed and overwhelmed with the appearance of their skin. I think in general, dairy and sugar are probably the two biggest foods that have been shown to contribute to acne flares. Dairy in particular, and skim milk rather than whole milk. And that's more because of the sugar content in the skim milk. And what it happens is that it turns on this receptor, insulin growth factor 1 receptor, which stimulates the oil glands. And oil is one of the big contributors to acne formation. So oil, or your sebum, dead skin cells, and bacteria. So by stimulating the oil glands and contributing to the inflammatory cascade that ensues. So, and sugar can do the same thing, stimulates the same receptor. So it's a big kind of inflammatory load.
Now, what about sheep's milk? Does it do the same exact? That would still count, like, or goat's milk? Would that also count, or is it a little bit better?
So that's another great question. So there are a lot of people who don't tolerate cow's milk very well, but will tolerate sheep and goat's milk. And, looking at the whey and the casein and some of the proteins that are in the cow's milk, as well as the hormones, if you're not drinking organic milk, and the hormones that may or may not have impacted the cows whose milk you're drinking. So that very well can make a difference. And as I shared, it's very individual. So broad sweeping foods, dairy and sugar, but not everyone, those won't necessarily be everyone's triggers.
What about gluten? Do you see that gluten is also a trigger, or not as much as dairy and sugar?
So again, it depends. There are some people who are gluten sensitive, gluten intolerant. And so because of the overall inflammation that it may cause in someone's body. Acne may be one of the manifestations of that. So we always talk about like the big five that are commonly talked about. Corn, soy, dairy, gluten, and sugar are kind of the big ones that, if you're doing just kind of a broad sweeping elimination, those are usually the first recommended foods or food groups to eliminate. But again, not everyone will respond. For some people, something that seems as healthy as strawberries or something like that, if you have some sort of sensitivity, that might be your trigger. So again, it's kind of hard to be very dogmatic about things. A lot of it is try, do an elimination. But if you're not getting the results, and that's where food sensitivity testing to really kind of pin down what your individual sensitivities might be.
And would you say honey and fruit would count in your sugar, or would you say honey and fruit, natural fruit, are okay?
I think that, fruit would be more okay than honey. Some people don't tolerate honey very well. And so I think, again, it's a matter of kind of tuning into what your body needs, seeing how you respond to certain foods. You had mentioned gut health. So it's not just you aren't just what you eat, right? It's what your body can absorb, assimilate, process, what your microbiome can absorb, assimilate, and process, and how it deals with the food that you're taking in. And so when there is an imbalance, foods that you might have been able to tolerate previously or would be kind of the party line of what's considered healthy, you may not be able to tolerate that. And as a result, it manifests as breakouts or skin inflammation or rashes or bloating or, a whole host of symptoms.
And how can somebody identify the root cause of their cystic acne? And does sunlight benefit cystic acne?
So that's a great question. And as with most things, there usually isn't just one contributing factor. So when we look at cystic acne, certainly there are individuals, if there's a strong family history of cystic acne, there may be a genetic predisposition. Looking at diet, just as we talked about, are there things in your diet that could be contributing? So looking at taking out as much of the processed foods as we can, eating a nutrient dense whole foods diet, making sure that you're hydrating enough. Are there products that you're using on your skin or in your household that then are on your hands that could be disrupting your skin microbiome and contributing to acne flares? Are there certain medications or supplements? There's a really interesting study looking at B12 supplementation having a correlation with acne flares. So things that we think may be doing us some good could actually, in some individuals, be contributing to flares. Makeup that you're using, hormone imbalances, right? And then stress. So that's a lot of things that I'm sharing, but it's usually not one thing. So you kind of go layer by layer and look at your entire environment and the soil in which your skin essentially is growing within, and look to see if there's any contributing factors.
And do you think that it's good for your skin to get extractions often? And what's the best way to extract pimples? And can extracting pimples cause more breakouts?
So extractions can be quite helpful. Certainly, when we talk about open comedones and closed comedones. So acne in general is formed in a hair follicle. And when there's dead skin cells and oil production and bacteria, and that kind of dilates the hair follicle, and it can, get obstructed. So you may need a little extra help to clean those pores out. It's a matter of how it's being done. So I always suggest, we always talk about don't pick your pimples or pop your pimples yourself because you can cause a lot of additional inflammation. So going to a skilled professional like an esthetician or dermatologist do extractions. And so it's not something that needs to be done all the time. Depends on the severity of the acne. Some people do go, for a period of time, once a week, once every other week, maybe getting facials and doing some gentle exfoliation with peels and such. But just squeezing yourself or using tools that you can buy at Sephora or something have the potential to cause more damage and inflammation and actually potentially secondary infection and making things worse rather than better. So I would definitely seek out the help of a skilled professional.
And this is a question I like to ask all my guests is just walk us through a day in the life of yourself. What did you eat yesterday? When did you eat it? And are there certain foods that you are off limits or that you avoid?
Yeah, that's a great question. So I have had to, over the last several years, shift my way of eating significantly because what I thought was healthy and all the things that I talked about of like things that would be healthy for somebody else were actually making me quite ill, and I've had to do food sensitivity testing. So in general, I practice a form of intermittent fasting. So I will have my black coffee, oftentimes with a little cinnamon, like yesterday morning. And then I usually am eating after I work out, probably at 11 or noon. And yesterday was wild caught Alaskan salmon because I'm very fortunate. My husband goes on a fishing trip and he stocks our freezer with salmons to get those healthy omega-3s.
I don't like salmon.
Oh, you don't?
I love raw tuna, but I wish I liked salmon. It's so good for you, but I just don't like it.
Yeah, well, that's okay.
Yeah.
There are ways to get omega-3s. And a green salad. So that's what I had. And then for dinner, we did roasted chicken with butternut squash.
Awesome. Well, let's jump right into the listener questions. This is from Taylor in Austin. I've always had oily skin for as long as I can remember. I've literally tried every product out there, and no matter what I do, I can't control it. I heard the reason for this is actually because I have dry skin and my skin is overcompensating because of the oiliness. Is that true? Do you have any product recommendations, and is there anything I can do to help my oily skin? Taylor in Austin.
All right. Well, Taylor in Austin, great question. And first and foremost, there's a lot of great products out there. But before you go and spend your money on products, taking a step back and looking at what are your daily skincare habits. And so the question would be, how often are you washing your face? A lot of people think that when they have oily skin, they need to like wash and overwash. And what can happen is that you actually can make the skin a little bit more dry and irritated, and then your skin does kind of overcompensate and produce some more oil. So for those individuals with oily skin, using a gentle foaming cleanser twice a day, maybe 3 times a day if you're working out, but not more than that. And also moisturizing your skin. I think that people with oily skin think that they can't moisturize because they're going to be making their skin more oily, when in fact that isn't true. Choosing an oil-free, non-comedogenic moisturizer would be the product type that you would be going for. But your skin actually, just because it's more oily, you still need to maintain the skin barrier and the integrity of that. So using a moisturizer is important, and not scrubbing hard too. When you're washing your face, a lot of people think they need to scrub the oil away, but that actually can cause more irritation and actually stimulate more oil production.
So we had a girl on our podcast that's recommended that if you have oily skin, that you should actually put oil on your skin, that putting an organic oil on your skin will actually reduce the amount of oil. Do you agree with that?
I personally, I have dry skin, so I actually like oil cleansers. I think it really depends on the individual and the type of oil that's being used. Some people with oily skin, especially if they have been kind of overwashing and scrubbing and things like that, and or using toner. So for the oily skin folks, toning down how much you use the toner, because that actually can, it's an astringent that can strip the skin of natural oils and make the skin feel tight and dry. So in those cases, an oil cleanser or using oil on the skin could be helpful. I think again, it's there's a lot of experimentation. I don't like to be very dogmatic. A lot of it is trial and error, seeing how you respond, and looking at what you've been doing for your skin up until that point, because it could be helpful, but it also, yeah.
I'm so excited that my second edition book came out, and I've added a ton of new content with actual transcripts from a bunch of thin eaters that I interviewed. Go to Amazon or go to chantelrayway.com and you'll get a bunch of free gifts when you buy the book. We also have a new video course featuring all the thin eaters coming out, so go to chantelrayway.com for more. If you're wanting to take yourself to the next level, everyone needs a coach. Every professional player has a coach. We want to come alongside you and help you in your journey. Go to chantelrayway.com/coaching. Now back to the show. All right, this is Caroline in Grand Rapids. When I was younger, I used to have really bad acne. As I got older, I finally gained control of it, and now it's nowhere as bad as it used to be. But now I have really bad scars. It's so embarrassing, and I always feel like I will hate my skin. What's the best way to treat these scars?
So that is a great question. And thankfully, in this day of technology, we have a lot of lasers that can help. So going to see a board certified dermatologist who has an interest in scars, chemical peels. Oftentimes it's not just one thing. It is the synergy of different modalities put together. So oftentimes you may use a topical retinoid combined with a series of chemical peels, with light therapy, with resurfacing laser procedures. So again, everyone's an individual, depending on the severity of the acne, scarring, subcision. Sometimes if it's just like an ice pick scar or something that's a little bit deeper and causes an indentation, we can go in and kind of break up the scar tissue. Sometimes filler can be used. So the good news is, I know that's a very long-winded answer, and I feel like I've been very long-winded this whole time, but skin is very complex. It's your largest organ. It's an amazing organ. And everyone is going to be individual. And the good news is that there are so many things that can be done. So it breaks my heart that she's had such a bad experience and feels badly. But the great news is there's a lot of things that can be done to help.
Okay, this next one says, recently I've been getting severe acne and I've tried every product and face wash I can find, but nothing is working. I've done a little research about Accutane and Benzoyl. Are these good products that I should be looking into? Do you have any recommendations for severe acne? Rebecca in Lexington.
Okay, Rebecca, that's another phenomenal question. And I'm sure there's a lot of other people that have similar questions. So before diving into, when I was practicing traditional derm, I'd be like, 100%, we need this medication. And instead of just blaming and taming it with drugs, really looking at when you say you've done all the things, what are those things? And have diet and lifestyle factors played, how much of have diet and lifestyle factors played a role in your acne management? Because that would be one of the first places that I'd want to look. And the good news is there's probably a lot of room to insert some changes that could be incredibly beneficial. The downside is it's not a quick fix. So Accutane is an amazing medication. I think when all other choices truly are exhausted, it's a 5-month course. It does require blood work and close monitoring. A lot of people tolerate it well. Some people experience a lot of side effects. So before diving into something that requiring that much of a commitment, I really want to explore, diet, sleep, stress, what products you're using. Is there any supplementation that could help boost liver support to help clear the toxins, clear the hormones, and things like that? So that would be my those are good medications, but that wouldn't necessarily at this point be my first go-to.
Okay, and have you seen people that have had bad side effects from those?
So benzoyl peroxide is a really, in general, really well tolerated. I mean, you can get it over the counter. The thing to know is that it can be drying. So some people experience dryness and irritation. The other thing, it has a bleaching effect. So uh, only use like the towels that you could care less about, or white towels. Don't use your favorite black towels because it will bleach them. So that's really the only downside with benzoyl peroxide. But Accutane, um, I have seen, Accutane got a bad rap for being associated with depression and suicidal ideation. My personal experience is that the individuals who were dealing with serious acne, they already were depressed. Their self-esteem and their self-image was already so low that when they were starting to see improvement with Accutane, their mood improved. The side effects really were skin dryness, irritation, dry lips, sometimes night vision, because it's a vitamin A derivative. And so you need vitamin A for skin cell turnover, but too much of a good thing is not always a good thing. Joint aches and things like that. But I never saw any significant mood changes except for the better.
Okay. This next one is from Dawn in Orlando. I've never been one to use sunscreen until about a year ago when I realized there was a little spot on my nose that looks a little scary. It's a pretty dark spot and it peels pretty often, and it gets darker and drier if I'm outside all day. Every time I go out in the sun, I use an SPF of 50 on that spot. I reapply sunscreen if I'm out all day. I haven't been diagnosed with any kind of skin cancer, thankfully, but I wouldn't be too surprised if I eventually do. Is there anything I should be doing to prevent skin cancer? And should I be using a higher SPF to help with any damage already done to my skin? Dawn in Orlando.
Oh my goodness. Dawn in Orlando, have you really gotten that spot checked out? Please, 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 please do. Because what that sounds like, a spot that peels off, it sounds like a precursor to skin cancer called an actinic keratosis, which really just tells you that you've had a significant amount of sun exposure over your lifetime. And the issue is you can see that spot, but it's all that we don't see. And most of the time there's a whole field effect. Like your whole, you're the one spot on your nose didn't just get the sun exposure, your whole face did. So I am concerned about long-term risk of skin cancer and wanting to minimize that. So, people always talk about SPF being your BFF. And I'm a big proponent that it should be part of your inner circle, but you need some more friends. so wearing sunscreen on a daily basis is important. So just like you brush your teeth using moisturizer that has sunscreen in it, 50 is fine. You really aren't going to get more bang for your buck above 50. In fact, the FDA is changing the guidelines. The difference between the protection you can get 50 of like 97, 98% versus 100 of 98, 99. It's a matter of being consistent about putting it on every single day and how much you put on to actually get that full SPF protection. So wearing a hat, a broad brim hat with a 3-inch brim that'll actually give some shade over your face is key. Wearing sunglasses to protect your eyes and the sides of your face is also important. And before you even go outdoors, really filling your plate, building your resilience from the inside out. And that's where eating a whole foods, nutrient-dense diet, filling that plate with the rainbow of fruits, veggies, getting your omega-3s, your vitamin C, your vitamin E, all of that, because that'll help fend off the oxidative stress that you're getting by being exposed to the sun. So first things first, get checked out. Don't guess, test, get a board certified dermatologist to examine you. And then all the other things, hat, sunglasses.
Gotcha. And, we had a girl on our podcast that talked about homeopathic sulfur and boron to help with psoriasis. Have you had any experience with any homeopathic treatments for psoriasis or any other things that help with psoriasis?
So, I am not an expert in homeopathy whatsoever, so I'm not necessarily familiar with that protocol. We do use sulfur in a lot of treatments for acne. Right, there are sulfur-based medicines that are used, so that is not unfamiliar. I think what we're finding now, the gut-skin connection, especially with regards to psoriasis, is becoming more and more highlighted. And so the things that you can do is the same for psoriasis or eczema or acne, is really looking at diet and lifestyle. So with psoriasis in particular, potentially an elimination diet of sorts, or really tuning into foods that may cause flares. So being really mindful of, okay, is it gluten? Is it dairy? Is it sugar? Is it corn? Processed foods, eating a nutrient-dense whole foods diet. We know that psoriasis is significantly impacted by stress. So really tuning into, okay, what's happening in your life right now? And there's no way to get rid of stress, but there are always opportunities to reframe it and to help manage it. Mindfulness, meditation, some exercise, really connecting. I think psoriasis can be a very isolating skin condition at times because people don't necessarily understand it. They may think it's infectious, or the individual who has it doesn't feel like they want to be close to somebody else. But really that community and connection is really important and powerful. Sleep is another huge factor that most people don't prioritize, but we know that it helps the body heal, rest, and repair, and help with stress modification. So those would be some things, not necessarily homeopathy, but a little bit more a holistic approach to psoriasis.
Awesome. Well, thank you so much for joining us today. And where can our listeners go to follow you and your work?
Yeah, so they can follow me on my website, which is drkeirabarr.com, and on Instagram, same thing, at Dr. Keira Barr. And yeah.
Awesome. Well, and if you have a question that you want answered, go to questions@chantalrayway.com. We'll see you next time. Bye-bye.